New reporting by The Intercept reveals that a pro-Trump healthcare network pocketed at least $15 million off of patients selling hydroxychloroquine, ivermectin, and online consultations. According to hacked data The Intercept obtained, thousands of patients created accounts to be seen by a physician. Patients pay $90 for a phone consultation, but according to multiple customers, they never received their phone call after paying.
So joining us now to discuss are Michael Starr-Hopkins, Democratic strategist and Senior Vice President of Firehouse Strategies, and Robbie Suave, Senior Editor at Reason. Welcome to both of you.
Thanks for having us.
Thanks for having us.
Absolutely. Now, Michael, let me start with you. Is this the consequence of immense institutional distrust that you're going to have sort of rogue actors stepping in to fill the vacuum that experts have kind of left open?
I mean, I think this is snake oil salesmen who have been around forever. Whenever there's a problem, there's someone who tries to sell some fake solution, and I think this is no different. It's sad, it's immoral, and I think there's a special place in hell for people who kind of do these things.
And Robbie, I wanted to ask you, and Emily, I'm curious for your take on this too, because having reported on both the conservative movement and the progressive movement, one thing I've noticed that's kind of different about the two is it seems easier to fleece conservatives. Like there's an entire gigantic industry of newsletters that sell stock tips and sell gold and sell all sorts of products. There's this entire this PC cleaner, for instance, to like these old and a lot of these consultations and a lot of this ivermectin and hydroxychloroquine was sold via newsletters to all of these different church groups and all of these newsletters that collectively make up the kind of base of the conservative movement. So Robbie, what is there some fundamental difference that allows that to flourish on the right in a way that it doesn't quite on the left?
I don't agree with that at all. I think people are easily fleeced on all sides of the political spectrum. You're right that specifically with related to COVID quack cures like hydroxychloroquine and ivermectin, yes, you have people on the right being scammed much more easily. The fact that there are kind of right-leaning pundit media figures, political figures, Trump himself in some cases, kind of backing up the dubious cures does not help. And maybe you don't have an equivalent of that exact thing, but people on progressives, liberals, mainstream Democratic people, they get scammed not by this exact thing, but I mean, isn't like the work of Robin DiAngelo fleecing people a little bit? You get sold quack cures for racism, or basically on the other side. So I don't think people are. If you work really hard to fool people, there's some minority of people you're going to succeed at fooling, and it's sad. And they should bring fraud claims or whatever.
I was going to say, people on the left get fleeced out of thousands of dollars for like healing dinners where they
talk
a lot of wellness
through stuff like as well.
There's that, and there's the struggle sessions. And my answer for that would be basically just that on the right, it's easier to notice because people feel like they've had to build up this separate infrastructure, whereas on the left, a lot of it comes through the mainstream infrastructure, so it's kind of less noticeable because it looks more mainstream, whereas on the right, it looks more Republican or conservative because it's specifically within that infrastructure. Now, America's frontline doctors have also reportedly been at the forefront of steering Americans away from vaccinations. Earlier this month, founder Dr. Simone Gold announced a lawsuit against New York Mayor Bill de Blasio over an executive order that mandated vaccines. She also promised the group would continue to fight against vaccine mandates that, quote, harm all Americans. Michael, before we toss to you, I will add that one study conducted this year found PhDs actually have the highest rates when you sort by educational attainment of vaccine hesitance. What do you make of all of this?
Yeah, I mean, actually, that's interesting. I have no explanation for that part. But, when it comes to vaccines and COVID, I think the majority of us can agree that getting vaccinated is the smart decision, not just for ourselves, but to keep others safe. And so people who continue to perpetuate this myth that there are dangers in vaccinations are continuing to perpetuate the problem that we're dealing with. I mean, we're at now, I think, over 700,000 Americans dead. In the state of Florida, they have had more people die after vaccines than they did before vaccines are available. This is a long-term problem that I think is bigger than just COVID-19. It's about the country and where we are in our ability to have conversations and have absolute facts. And so I think it's something we're going to be dealing with for a long time.
And Dr. Gold is involved with this health network, and she's also one of the doctors that Trump helped to elevate and to platform. Robbie, what do you think that it's more than $10 million, more than $15 million over about just a 2-month period. That the Intercept obtained data for. What does it say that there's that amount of money? Like that's a significant amount of money for one healthcare network to be extracting from people. What does that say about the size of this?
It's certainly a significant amount of money. I don't know in the scheme of things how much money it is. It reminds me of like Alex Jones, right, is selling. On his videos used to sell like supplement type things, I think. I suspect something like that. There's some of that going on in right wing, even in more legitimate right wing media circles. So it's I don't know that. So we do know that vaccine hesitancy and vaccine concern is pretty widespread. When you're talking among very conservative or very Trump supporting people, and that's a shame because there's no reason this vaccine debate needed to take on this partisan, become part of this like tribal battle. For those of us who want more people to get the vaccines, more Trump people to get the vaccines, more of everyone to get the vaccines, it's incumbent on us to just be more tactical about how we market vaccination. If they're very concerned about coercion, I like to say, okay, well, I'm not saying I'm mandating it for you. It is your choice. You're absolutely right. It's your choice. But here are all the reasons it would be a smart decision for you to get it, even as just a therapeutic, et cetera, et cetera.
And a lack of information doesn't seem to be the problem. In some of the data that we obtained at the Intercept, you have the doctors very prominently telling their patients this is not a recommended treatment by the FDA or by any other medical authorities, and we are not to be held liable if you have not been completely transparent with us about what your underlying conditions are and you have an adverse health effect. Be warned that what we are prescribing you here is not recommended and could hurt you, and you cannot hold us liable for it. Like they're explicitly telling that to their patients. Michael, if you're on the receiving end of that note from your doctor, what is it culturally that makes you say, okay, fine, still give it to me?
Well, look, and I mean this in the most respectful way ever. I think that there's an issue with low information individuals being co-opted and being taken advantage of. When you look to certain media individuals, when you look to people who you trust to give you good medical advice, and they're lying to you, I understand why you would be scared. If you think that Donald Trump is someone who is trustworthy and you hear him make comments about vaccines and, you can or you cannot get vaccines, kind of playing both sides of it, I understand why you would be hesitant. And so I think it just goes back to the partisan nature of this, but also the fact that there will always be a certain group of people who will be willing to make money at the cost of everyone else.
That last
brilliant people make stupid decisions all the time, right? Studies show, I think, that like the most partisan bubble people are better informed than people in the middle, right? I've seen studies like that before, so it's just doctors can be stupid about things too.
Well, yeah, I was just going to close by saying I think it's actually in a lot of cases high information people who are so high information they see that YouTube is censoring information about ivermectin, and it creates that sort of interest in it and that need to push further. So I don't necessarily know that it's a low information, high information thing, because we're all living in this like super high information world with Twitter and YouTube, and nobody knows what to trust in that high information world.
Some of the most knowledgeable people about climate science on an amateur basis are climate denialists. Like if you've ever had an argument with a denier, they know far more than the average person does about the climate science. They're not a scientist, So they don't completely get it, but they know an awful lot about it.
Yeah, as Robbie said, it's sort of like partisanship and high information is an interesting combination.
A dangerous drug.
Yeah. Well, thank you.
It's not recommended by the FDA.
Not yet, at least. Thank you both for your time this morning.
Thanks. You guys take care.
And next on Rising, Robbie is sticking with us to give his take on the quote that has the ACLU under fire right after this.